Okay, so the last two trays that we tried were a little too small, so we're gonna try this one. All right, this one fits perfect. Okay, as you can see, when the tray is seated, the impression tray is sitting on the teeth, and the border of the impression tray is fitting down into the vestibule where the patient's lip meets the patient's uh, gum tissue and soft tissue covering their teeth. Also, we want to tip your head back for me. We want to open really wide. We want to be able to visualize here that when we want to pretend like we're inserting the impression tray with impression material in the tray. So what we want to try to do is see the back of the tray. Open really wide, boss. We want to see the back of the tray touching the patient's soft tissue on the roof of their mouth. It doesn't have to go all the way all across. Everybody's mouth fits differently. If you wanted to, you could put wax across here, but the idea is we're creating a border so that the impression material can't flow back towards the patient's throat. All of the excess impression material is going to flow forward towards their front teeth, which is going to fill up all of the vestibule area and make sure we get a really good impression. There's a little bit of space between the back of the tray and the patient's and the roof of his mouth, so a little bit will flow back. But as long as I do a good job of putting the tray, inserting the tray, and seating the tray from back to front like this, then most of the material is going to come forward, and I think we should be okay. So the next step is mixing the alginate. It's not really crucial. My preference is to add the water to the bowl first and then add the powder to the bowl before I mix. Again, like I said, it's not crucial. In this case, the powder was already in the bowl, so we're gonna add it in there. I hold the bowl with one hand. I get a little further from the patient, and I mix by pushing the spatula straight down into the bowl and incorporating all the powder into the water. If I notice that it looks like a thick mix, it's kind of dry, then I may add extra water because it's going to set up faster. This looks pretty good. So now that all the powder is incorporated into the water, you can see how I'm just kind of mixing it and getting it a little better mix. Then I'm going to hold the bowl and close the bowl, and I'm going to mix quickly to make sure that everything is really well incorporated. And then I'm going to spread it along the bowl like this, and now we've got a really good mix. Then I'm going to scoop the entire bulk of the impression material out on my spatula, and I'm going to spread it into the impression tray so that it's in the front of the tray mostly, and not as much in the palate, more where the teeth are going to go. Open wide for me. I'm going to retract with one side, retract with the tray on the other. I'm going to watch the tray go right back where I tried it in, insert from back to front. Okay, and we're using kind of gentle pressure to make sure that the material flows all the way out of these little perforations, which is going to let us know that we're seating the tray all the way down. It's harder to feel when the tray is touching all the teeth, when the impression material is in the tray, but you'll be able to feel it with the tray, and you'll be able to visualize it when the material stops flowing, when the impression material stops flowing through the perforations. Then you know that you've seated the tray fully. It's important to keep the handle kind of lined up with the midline. Sometimes it's easy to get the handle off to the right or off to the left. That will distort your impression. It's really important to keep that handle right on the midline of the patient's face and teeth. And this mix was kind of thick, so it was going to set up a little bit sooner, and I think it's probably already set up. We're just going to give it a couple more seconds. Normally, I like a little more running of a mix. It gives you a little bit more working time, and also I like the flow of a more runny mix a little bit better to make sure that we get all the anatomy, but I think this one should be fine. Okay, one easy way to check to make sure that it's done is if you have any excess material on the patient's lip or on your finger, just check it, and if it's set, then you're good. Now when you remove it, what you're going to do is you're going to take your finger, your index finger, and you're just going to put a little gentle pressure all the way on the back corner of the impression tray. That's where the impression is sealed, And once you release that seal, then it should come out really easily. So before we look at the impression, let's take a look at our patient. So then we can release him to go wipe his face. Notice that with this technique, there's no mess. There's nothing on his shirt. We didn't use a bib. There's nothing all over his face, on his neck. There's a little bit of powder on his lips. It's really easy for him to clean, but no mess. So I'm gonna sit you out, you can go wipe your face. And now as we take a look at the impression, some keys. Number one, obviously we gotta make sure we have all the teeth, which we do, okay? Something else, another key point to take a look at, if we look all the way at the anterior teeth, you can see that the teeth were touching the tray. You can see a little bit of metal that's showing through. You don't see as much in the back. So what that indicates is I may have been able to seat that impression a little bit further up in the back, okay? It still came out good, so that's okay. And most of the material, as you can see, it didn't flow back towards his throat. It flowed forward, and that's why you have this excess material up here where the vestibule is. But this is not excess from the standpoint of unnecessary. We need the material up here because we're trying to capture not just the teeth, but also the soft tissue. So the fact that this impression material flowed up into the vestibule and captured all of that tissue is exactly what we want. So this is a pretty good impression.